Hi, I'm Lorin Berland,
And I'm Bonita.
and we're here to talk about how we use the Smile Style Guide every day in our cosmetic dental practice. Um, when you're doing a smile makeover for somebody, a lot of times the lower teeth, they're pretty easy to decide. Everybody wants straight, white, even teeth. So there aren't a real lot of options or choices available. But when it comes to the top teeth, that's where people really get their personality, or their smile personality. So we begin by educating the patient. We explain to them the different four incisors and the canines and the bicuspids. And then we like to start looking at a profile view. That's a lot different than what patients are used to. They're used to always looking in the mirror and seeing the 6 front teeth. That's what they're called, the social 6. But in fact, I don't think they're that social, because I think socially people are looking at an angle. So we want to get them to look at their smile from an angle or at a side. And the first thing we want to do is select the cuspid shape. And actually, more important than picking out the cuspid shape is to look at the bicuspids too, because a lot of times they may have misshaped bicuspids, they may be discolored, they could have old silver fillings, they could even be missing them. And the patient, always looking directly in the mirror, they're not aware of what other people see. So we want to start out by choosing the cuspid shape and also getting the patient aware of their bicuspids. Now, if the bicuspids are perfect, you might suggest that they whiten their bicuspids before they start the smile makeover. So anyway, there's basically 3 types of cuspids: flat, pointed, and round. We generally discourage our patients from going for the flat cuspid, because cuspids usually do not come in flat. They're usually worn down, ground down to become flat over time. And nobody wants really an old-looking smile, especially if they're going to invest time, money, and aggravation in getting a better smile. So anyway, Bonita, this is how we do this in our office. We take a look at the side, and first you look at your bicuspids after looking at the pictures and decide what you think. And tell me, which shape of the cuspids do you find most attractive?
I'm really drawn initially to the pointed cuspid, pointed or the round, but I think the pointed is more aesthetically appealing to me.
Well, if we're going to create your smile, we want to make sure that we know what you like. Now, sometimes a patient can't really decide between the pointy or the round cuspid. And in those cases, we can combine the two, kind of split the difference. Not quite pointy and not quite round, something in between. Now, after we have looked at the profile, chose the cuspid shape, the next thing to do is to choose the incisor shapes. So we'll skip the flat combinations, flat cuspid combinations, and we'll come to the pointed cuspid category. We start with a little profile. Now, every page of the 6 variations, there's 6 combinations of incisor shapes. There's actually 9, but in 3 of them, the lateral is more square than the central, and that is always a cosmetic no-no. The lateral incisor should never be more square than the central. It could be as square, but not more square. So every incisor combination has 2 pages, and it's got a full face picture, a profile of that incisor combination, and the full face non-retracted picture. We like to use non-retracted pictures because the retracted pictures are kind of confusing for patients. generally they lose sight of the shape of the teeth and they focus on the gums. So anyway, we're going to go from very square teeth to very round teeth. So this here is the square incisors. These are square central incisors and square round laterals. These are square centrals and round laterals. These are square round centrals and square round laterals. And these are square round centrals and round laterals. And all round teeth. So, you know, Benita, you can go through all these pages, and you may just find it easier to go to this section that has all 6 choices directly in front of you.
Let me see. Initially, when I'm looking at it, either P2 or P3 really grab me as being what I want to see my smile look like.
Well, in a situation like this, you might want to go back and look at the profile and the full face pictures with these combinations. Here's the P2, full face, profile, and straight on. And here's the P3. Sometimes this can help. Just take a look. Sometimes the profile shot can tell you something that the straight-on shot can't. Can't make up your mind?
It's hard to tell. This P2 is a little bit more square, which I like, but P3 gets a little bit softer. It's hard to tell.
Well, in a situation like this, I would recommend you go with the lower number design because those are more square. Because you can always make a tooth more round without shortening the tooth, but you cannot make a round tooth more square unless you shorten the tooth. And generally speaking, especially when you're trying to create a more youthful appearance, regain youth, you don't want to shorten teeth. So in this case, I would probably go more with the P2 because I can change those square round laterals and I can modify them and make them round down the line. Or you may even want, for individuality, one tooth square round and the other lateral round. So those are all the ways we work with it. But now that we've got the incisor combination, I think the next situation is length. And length does matter. So we like to look at all the different variations between the 6 front teeth in length. And we go from straight across to the long central, very young look. And you might want to take a look at these.
Well, I think the first one it's too flat across. You know, there's not much variation.
And it may be perfect for somebody else.
Right. For what I'm looking for, since this is my personal smile, I think between the second and third one is what I'd like to see.
Okay, I understand that. So we can either go with number 2 or number 3, or we can kind of work in between them. But the important thing between both of them, the centrals are a little bit longer than the laterals, and in number 3 they're a little bit longer than the canines as well. And there's even more of a difference between the central and the laterals. Now, once you've decided that, we can continue to go with either cosmetic wax up that we can use for a trial smile, or we can do cosmetic imaging, or we can go right to doing the case. The important thing is you get as much feedback from the patient as possible. Because let's say somebody's got ground down teeth and they want to recapture some youth, and the teeth are flat and square. Now if you do a case like that, and let's say this is the way their teeth were when they were younger, round, but now they're all flat, there's no way for you to know this. And unless the patient brings you pictures of when they were young, or unless they spend a lot of time looking at magazines, which is kind of hard to tell because, you know, different people, what looks good on one person may not look good on another. It's best that you let the patient choose. Also, when the patient chooses their smile, they generally tend to be happier with the smile you give them. But what I'm trying to say is look at the huge variation between round incisors and, let's say, square incisors. Or better yet, looking at the 6 options. Now, if somebody comes to you and they're hoping to go to here, and you give them here or here, you are not going to have a happy patient. Or you will be grinding and grinding and grinding. Now, one thing I've noticed is since David Traub and I came up with the Smile Style Guide, I suffer a lot less from post-cementation depression. And if you're doing a lot of cosmetic cases, you know exactly what I'm talking about. So, you know, these are the 18 smile variations, and we've got 4 length variations. And I think that you're going to find this very helpful in your cosmetic consultations and your cosmetic cases. And your patients will appreciate being involved in their own smile design. Thank you.